Hello everybody, TGIF Dr. PK here from Dr. PK Live. This is part of series of my video called Your Question, My Answer. So I got this question and this is in response to my video about iron deficiency and vitamin D deficiency video which I posted last week. So user, your derm pack is asking how do you work ferritin level in your diagnosis and treatment plan? Thank you. So this is very interesting question because ferritin is one of the most misunderstood labs in medicine, and I'm going to explain you why. Where we lots of other folks make mistake. So I'm going to break this down exactly how I use it clinically. Now, of course, I've learned it over the years. So there was a time in the early phase of my life, about 30 years ago, when I saw this number as a very simple number. But over the years, with experience and more knowledge, things have changed. So I'm glad you asked me question now because answer is different. If you'd asked me same question 30 years ago, my answer would have been totally different. So I have been involved in my knowledge and understanding about medicine. So let's understand what ferritin represents. Ferritin is iron storage. Think of it as your body's iron bank account, right? It's a bank account, it's saving. So hemoglobin tells me how much iron is being used. Ferritin tells me how much iron is saved. So basically it's a saving account. But here's the key. Ferritin is also acute phase reactant. Means it goes up with inflammation. It goes up with infection. It goes up with autoimmune diseases. It goes up with liver diseases. So whenever somebody is interpreting this ferritin level, they need to consider all this stuff. Does patient have inflammation, infection, autoimmune disease, or liver disease? Liver disease is a common problem now because lots of people have fatty liver disease. So we need to take into that in our consideration. How I interpret ferritin levels, if it is in between 15 to 30, that means it's low. That almost always iron deficiency, even if your hemoglobin level is still within normal range. And many patients become symptomatic. They have fatigue, hair loss, restless leg syndrome, etc. Ferritin level between 30 to 100, that's a gray zone. Now, I look at hemoglobin, MCV, and transferrin saturation, and CRP, which is inflammation marker, C-reactive protein. If transferrin saturation is also low, that is less than 20%, that means there is a high likelihood of iron deficiency anemia. So if you have borderline ferritin, but transferrin saturation is also low, that's iron deficiency. Now, if ferritin level is more than 100 to 300, that usually indicates good iron stores. So what happens if it is more than that, like in the range of 500 or 1000? So 500 to 1000, I usually evaluate for chronic inflammation, liver disease, metabolic syndrome, and hemochromatosis. In fact, yesterday I have a young patient who's has a very high level of iron in his body, and I was trying to figure out what's going on with him. And he has no family history of chronic liver disease. Nobody had cirrhosis, liver failure. So then I found out, so it's a single guy who cooks in a skillet utensils. So when you have iron in skillet utensils and you're cooking, you are eating lots of iron. So I basically advised him to stop using that iron skillet utensils, and I'm going to check his iron level in 3 to 6 months. So, but some people who have real hemochromatosis issue will have a ferritin level very high. And so in case of chronic inflammation, other liver disease or metabolic syndrome. Now, how it affects my treatment plan? If iron deficiency is confirmed, I identify the causes. That's very critical. Why there is low ferritin? Could be heavy menstrual bleeding, GI blood loss, poor dietary intake, malabsorption, particularly people with a celiac disease, gastritis, or chronic PPI, use like pantoprazole, omeprazole, or bariatric surgery. So we're going to treat that with oral iron and vitamin C along with to enhance absorption. Avoid taking with calcium and coffee, and recheck in about 2 to 3 months. And goal of ferritin is minimum got to be more than 50 for symptomatic relief, but I aim usually for 100. If ferritin is high, you don't give iron. Instead, you evaluate for inflammatory markers, liver enzymes, metabolic risk factor, genetic testing if indicated. So a normal hemoglobin does not rule out iron deficiency. Early iron deficiency can have normal hemoglobin, low ferritin, and symptoms present. That's why ferritin is essential in fatigue workup. So ferritin is a strong marker for inflammation. It's a storage marker for iron level in your body. It's a guide for treatment, a clue to underlying pathology. It should never be interpreted alone, always within the clinical context. So thank you for watching. Have a good Friday.